Hello, Dr. Kemp here, Hammond Doc. Today, I want to talk with you about something that if you're a Hammond B3 organist, you have experienced. And that is the pain that is associated with striking your leg just above the knee when you are getting on the Hammond organ. It happens because of the bottom part of the organ, the base of the organ, of the cabinet hangs down, and so when you sit on the bench and you slide around to slide into onto the bench of the organ, your leg will often strike the bottom of that organ, and it hurts so bad. It's an intense pain. And so you're sitting there and you're trying to play and you're in pain, and it's just a terrible, horrible experience. Well, I want to talk about two solutions to that. The first is pretty obvious. Slow down. Move with caution as you're mounting the beast. That usually works for me, especially when I'm about to play someone else's organ. But on my own organ, this is what I do. I'll use some of this. This is foam strip. You can buy it at Walmart or a hardware store. You can buy it at Lowe's. Foam strip. And here's a piece that it cuts off easily with some scissors. I cut this piece off. And this foam strip has an adhesive back to it so that you can simply mount it to the bottom edge of your organ cabinet and cut it as needed. You know, just cut a couple of strips. If you're gonna, I mean, sometimes some people mount from the left side of the organ, others from the right side of the organ. So if you can get in on either side of the organ, then you need to cut strips about so long on for both sides of the organ. If you only mount the organ from one side, then cut a strip about, I don't know, 6 to 8 inches long, maybe about 8 inches long, for one side or the other of the organ. But either way, you want, once you've cut about that 8-inch strip of this, then carefully mount it on there and make sure it's nice and neat at the bottom of the cabinet of your organ. And the next time you spin around and hit your knee or the top of your leg, as I do, on the organ, you will be able to tell the difference. You will be thanking Hammond Doc for sharing this with you. Because inevitably, you're going to hit your leg on that bottom part of that cabinet. And if you have this on there, you will have cushion that will help you a great deal in terms of pain elimination and or at least pain reduction, depending on how hard you actually hit that cabinet. But what this will give you is some cushion when that happens the next time. So let me know if this helps you. Send me a message. Give me a message at the bottom of this video, and let me know how this worked for you. I'm not saying go in there and intentionally hit your knee on your organ, but go ahead and use this. And when you happen to swing around and bump your leg and bump your knee on the bottom of the cabinet and you experience what it's like, then let me know if this worked for you. It certainly works for me, and it has worked for years. And I just thought I'd share it with you as well. Dr. Kemp, Hammond Doc, saying to you, why don't you have a peaceful and wonderful day. Goodbye.